I firmly believe that support is best. I know there's a lot of talk or controversy around breast is best or fed is best, but I truly believe that support is best. And that support looks like whatever the family's feeding goals are. So I always say to my moms and dads, there's no right or wrong way to feed your baby. It's whatever works for you and your family. And then I'm here to help support you achieve those feeding goals, whatever that looks like.
Welcome back to another episode of Smashed Oranges. If you have not done so already, please click below and like and subscribe. It helps us keep building our community and bringing you fresh new episodes every week.
Awesome. Today we're super excited because we have an amazing guest for you. This is Leanne Rzepa. She is she started out as a registered nurse. She's internationally board certified lactation consultant. And the reason why we have her on today is that she is the founder of Nourish Lactation Consulting. And that is a huge business. It's kind of branched out. It's lots under its umbrella. And so we're very excited to delve into that. But she has been supporting breastfeeding and breast milk feeding mothers for over 24 years. So you've got a lot of experience under your belt. She launched Nourish Lactation Consulting in 2007, all while working in hospital and clinic settings and raising her 3 daughters, Kayla, Alyssa, and Maya. Over the years, Nourish has grown to offer a breast pump rental program, super cool, an online store, monthly workshops, and numerous community partnerships, including West Coast Kids and the Tsuut'ina Nation. Leanne's expertise and advocacy has been recognized widely. She's appeared on Global News Calgary to talk about World Breastfeeding Week and her passion project Angel Pump. I'm excited to talk about that one, which helps provide subsidized hospital-grade breast pumps to women in need. She's also been interviewed by CTV and today's Parent magazine. So we're very honored to have her here today. She's got lots of information for us. So thank you, Leanne, for taking your time and joining us on Smashed Oranges today.
Thanks for having me.
Amazing. So to get started, Leanne, we want to start at the beginning and just hear a little bit about, you started as a registered nurse, but how did you get into lactation consulting and why is that important to you?
So I've always enjoyed working with moms and babies. And when I had my first daughter, I really struggled to breastfeed. I really did not enjoy breastfeeding. I had a lot of pain. Pretty much every single issue imaginable, I had it. And I thought, why is this so difficult? I can help other moms figure out how to latch their babies properly, but I couldn't do it on my own. So I was going into breastfeeding clinic. I was getting a lot of support outside of the home. I'd had cesarean sections. I wasn't able to drive. I couldn't lift. And I just found it really challenging to go forward with my feeding journey. I've always also been a little bit entrepreneurial. So when I became an IBCLC in 2007, and at that point I'd already had my first 2 daughters. Kayla was born in 2003. Alyssa was born in 2005. Struggled with both of them. I figured now's a good time to try to blend my entrepreneurial spirit and my, healthcare profession together. And then that's how I created Nourish, which was the best way I felt I could support women in the comfort of their home to achieve their feeding goals.
That is so cool. I'm just really inspired by that because, as a new mom myself, it's really hard to imagine having 2 little ones and then seeing, okay, where can I also support other moms and build a business? So that's amazing that you're able to do that.
Yeah, I do think it's really important too because so many moms have such a different feeding journey and different experiences 100%. Within that. And so with that, I know we've spoken before about kind of your philosophy around feeding and like how to go about that the best way.
My approach.
Yeah.
So I firmly believe that support is best. I know there's a lot of talk or controversy around breast is best or fed is best, but I truly believe that support is best. And that support looks like whatever the family's feeding goals are. So I always say to my moms and dads, there's no right or wrong way to feed your baby. It's whatever works for you and your family. And then I'm here to help support you achieve those feeding goals, whatever that looks like.
That's so cool. Do you mind expanding a little bit more on maybe the different types of feeding that you've, helped families accomplished?
Yeah,
I don't know.
you bet. Yeah, no, that's right. Accomplished, established. So I would say majority of the families that I work with would like to begin breastfeeding. But a lot of them also have the idea that they would like their partner or a support person to be able to, share in that feeding experience by introducing a bottle at some point in time. So a lot of the families I work with are doing what we would call combination feeding. So they're doing breastfeeding, they're doing bottle feeding, or I do have some moms that are exclusively pumping and providing breast milk to their babies in a bottle. So again, there's no right or wrong. And it's whatever works best for that family. And then I can support the breastfeeding component. I can support the bottle feeding. I can support the pumping as well.
Amazing. Yeah. So to build on that, what would you say are the most common concerns that come up in moms in those first couple months postpartum?
Sure. So the most common reason that I'm consulted, I would say in the early days or weeks, is mostly for latching issues or moms that are experiencing pain with latching, worried about baby's weight gain, worried about their milk supply. They've been told that their baby has a tongue tie. Right. They're not quite sure what to do with that information, what the next steps are. Some moms are feeding multiples and need support kind of finding the balance of feeding two babies. Some moms are experiencing engorgement, plugged milk ducts, milk blisters. There's so many issues or challenges that can present in the early postpartum period. And then even after that postpartum period into like month 2, 3, 4, breastfeeding is always changing, right? That's why we describe it as like a feeding journey. You think you're getting into a nice groove, a routine with feeding, and then surprise, something changes. So we also support any feeding challenge that arises throughout that entire breastfeeding experience.
Amazing. So maybe do you mind walking us through like a couple of those main issues that people tend to run into, and like how do you support them in those? So what was one of the first ones?
Latching.
Latching is a huge one.
Latching. So majority of our support is provided in the client's home. So we come to their home, usually we'll sit down, I'll take a detailed history to get some more information on their pregnancy, their birth journey, how breastfeeding has been going thus far. And then I will usually weigh the baby at the beginning of the feed. And then I will observe the entire feed. I really feel it's important to observe from start to finish what is happening while the baby is feeding. I brought a little prop that I'm going to talk about why a lot of moms have feeding challenges. So I'm really not a fan of breastfeeding pillows. I did not bring the pillow because it's very big and bulky.
Similar to this, I suppose.
Yes, but this actually, I'll use this in a moment. Yeah. So breastfeeding pillows are designed to make you think that your baby should be feeding in a straight line across your chest. And how do we eat or drink?
Not in a straight line.
No, head above stomach, right? It's better for digestion. And for babies, when they're latching, head above stomach, it also allows them to latch more chin first. So I really focus on, the mechanics, the positioning, because often once we get rid of that breastfeeding pillow and adjust the baby's position, a lot of the latching issues resolve just like that. So I love how it can be so easy when we're just making these little minor adjustments. And then I also describe feeding as like a dance, right? Lots of steps involved. Mom's learning the steps, baby's learning the steps, and it takes practice. It takes practice before everybody's feeling a lot more confident. But I really, work through all the steps, ensure that mom feels confident in being able to latch baby herself. I do hear from a lot of moms, the nurse just kind of like rammed the baby onto my breast in the hospital, or it worked so well when I was in the clinic setting. And then when I came home and tried to recreate it, I couldn't. So I really want to observe and make sure that the mom feels confident in being able to latch her baby herself before I leave the house.
Yeah. Well, especially because that's kind of the beginning of your relationship with breastfeeding with your baby, right? It's like that confidence, the competence that you feel in being able to do that and recreating. And, I especially when you start to feel all those sorts of different emotions that might be associated with that frustration and things like that. I'm sure you can speak to that as well as just like the emotional aspect of breastfeeding is super intense.
I mean, the postpartum period, it is a very vulnerable period as a woman, as a woman who's now just entered into motherhood. Your hormones are all over the place. And yes, you're sleep deprived. You're wanting to make sure that you're doing everything perfectly. And it can sometimes feel very defeating. And stress does play a role in breastfeeding. When you are feeling stressed, your cortisol hormone rises, right? Cortisol is that stress hormone. And cortisol is not very friendly to the oxytocin hormone. And that's the hormone that helps your milk to flow, right? When your baby suckles at your breast, we get that nice release of oxytocin from the posterior pituitary. So if your cortisol level is high, it kind of blocks that oxytocin. And sometimes your milk just can't let down. And then you're feeling stressed, and then your baby's picking up on that stress, and that can make for a really difficult time.
So what are some ways you can help bring those cortisol levels back down? Or like when you're working with clients who that is maybe their primary concern, they're maybe experiencing a lot of stress for whatever their situation is. What are some of the key ways you could work with a client to bring those cortisol levels back down?
So one of the best things that a mom can do even before she starts to breastfeed is just skin to skin contact, just holding baby on her chest. That's going to help bring that cortisol level down, because that oxytocin is also that love hormone, that bonding, that connection hormone. So just starting with some skin to skin contact even before attempting to latch is usually a nice way to get everybody nice and calm and relaxed. And sometimes I will tell my moms, when you're latching, just even closing your eyes, doing a little bit of like deep breathing, visualize waterfalls of breast milk flowing. And sometimes like just distracting yourself a little bit by drinking from a water bottle, like having a little snack. Just sometimes we're so focused and we get very tense on like, okay, is the baby swallowing? Like, has my milk let down? That we just forget to just be in the moment. And sometimes just taking a deep breath and just letting your baby do what they know to do really can make a big difference in bringing that stress down.
So fascinating. Oh, this is so cool to me. I'm very excited because I'm pregnant right now. I'm going to be delivering in August with my second. And so I'm kind of, thank you. So I'm kind of taking it in, having experienced one breastfeeding journey, and it's going to be, I'm sure, different. Like every child is so different. And so just kind of mentally preparing myself for some of the key things that I can do to prepare for that relationship is so cool. So more on the latching, I'm really interested. So what are some common concerns with latch? And also I was wondering, you mentioned lip ties and tongue ties and things like that. Do you assess baby for that, or is that something a general practitioner has to do?
I can assess. I don't clip tongue ties or lip ties, but I can refer the family to a breastfeeding clinic or to a pediatric dentist who is able to do that. And sometimes with tongue ties or lip ties, mom might be describing, she's got a lot of pain with latching, or there's already some damage, or she's worried that the baby just isn't being very effective with milk removal or feeding all the time. So it is something that as a lactation consultant, I do always like to check to do a tongue assessment and a suck assessment just to make sure that we're not missing anything, because sometimes it does get missed even after the baby's delivered or for their first checkup. A physician, might do a quick check, but we know that there's a lot more function to the tongue than just being able to move forward beyond the lower gum. We have to look at the lateral movement, how the tongue moves up, how the tongue cups, the rhythmic, wave-like movement of the tongue while the baby's suckling. So it is quite an important assessment in order to determine if the tongue tie is interfering with feeding. Because a lot of babies might have a tongue tie and there's no reason, and we should not be clipping just because we think we see a tongue tie. We always want to give that baby the opportunity to breastfeed, to figure things out, to see how things go once milk comes in before we would decide whether or not the tongue tie is in fact interfering with feeding and then would need to be clipped at that point.
Yeah, because I feel like it's kind of almost become a little bit trendy, but that's one of the things that people assume. So how common is it to have that be an issue in the latch?
It is. I would say if a baby does have a tongue tie, it usually does contribute to some feeding challenge. Whether or not it needs to be clipped, that's kind of, I would say maybe 60% of the time it does need to be clipped. 40% of the time we can kind of work through the issues. Sometimes it's not necessarily the tongue itself that's causing the problem. Sometimes babies are born, they have quite tight sucking muscles. Their jaw can be quite tight. Sometimes like their shoulder girdle area is tight. So there's multiple factors that can be contributing to some of those latching issues. One of the other things that I see with latching is that, and I'm going to get my little breast. It rolled away. I was like, where did it go? Found it. Okay. So one of the other issues that I find, and it might not be super easy to see with my baby and cloth breast, but when the baby is feeding, the bottom lip should always be untucked and should be sitting lower on the areolar tissue, not right under the base of the nipple. And the baby certainly does not have to have the entire areola in their mouth. I had a mom the other day who said, I was told that the entire areola has to be in the baby's mouth. And as you know, when we're pregnant, like our areola often gets wider. And I'm like, no, that's not correct. We want to ensure your baby has more from the lower part of the breast, but the entire areola does not have to be in their mouth. So kind of what I like moms to do is just when the baby is latched on, just to kind of take a little peek and see where that bottom lip is sitting. The lip should always be untucked and should be sitting a little bit lower on the areola. Again, not right under the base of the nipple. If that is the case, then the baby usually is just pinching on the nipple.
Yeah, uncomfortable.
Uncomfortable, yes. And we don't want damaged, sore nipples because that leads to not wanting to breastfeed.
No kidding.
And then the baby's top lip, where that sits, the areolar tissue just kind of looks like a crescent moon shape above the top lip. So those are some things that I want my parents to look for, as well as just making sure that there's always a nice gap between the baby's chin and chest when they're feeding. Right?
So not totally tucked in.
Exactly, right? Okay. We cannot eat or drink with our chins down to our chest. Neither can our babies. So that's also why having them feeding head above stomach helps to ensure that it's more of a chin first approach into the breast with that nice gap between chin and chest.
Interesting. Okay, that's awesome. Yeah. So in terms of like pumping and breastfeeding, I'll speak from my personal experience. When I was first starting to breastfeed, is it typical to always have like a little bit of discomfort?
That's a good question.
Because for some context, you know, I was just like, well, this is a new sensation for me. Baby's starting to get used to it. I'm trying to figure out the positioning and stuff. And so then I would do some pumping in the meantime, just to make sure that I was, you know, catching some more milk or making sure that I wasn't too engorged or things like that.
Right.
So is that sensation, is that something that you can expect always or will last a super long time? What kind of things have you seen in that?
So breastfeeding, it should not be painful.
Okay.
I firmly believe, and from my own experience, that, you know, pain is your body's way of saying stop. Like something is not quite right here. We need to readjust. But like you said, breastfeeding or pumping, like it's a new sensation. Your breasts are getting used to being used in a way that they've really never been used before. Yeah. So there is, I would say, a normal degree of discomfort or kind of getting used to the sensation in the early days and weeks, but it shouldn't be painful. Okay. Often,
good distinction.
Yes, often moms will describe, like if it's a good latch, you want to feel a pulling or tugging sensation on the breast tissue, but not pain or biting or clenching. And when babies first latch to the breast, they have to suck with quite a bit of negative pressure to get the milk to let down. And even with a breast pump, often pumps have different cycles, and the first cycle is often quite quick to help trigger that letdown. So
take me back.
Right? So there is sometimes a little bit of like a discomfort, or it just feels a little bit different at the start of pumping or at the start of feeding. But once the milk lets down and begins to flow, whether it's with breastfeeding or pumping, there should not be any pain. You should just feel that pull tug. And again, if you are having pain, and I used to do this too, I'm like, oh, well, my baby's latched, just drink, just feed. And I would just push through the pain. And then I ended up with damaged, cracked, blistered nipples. Oh. So don't do that. Yeah. Don't do what the lactation consultant did. Delatch your baby and latch again. Like sometimes we just have to wait for that mouth to be that much wider, or just to be that much bolder, or just to support the breast a little bit differently. There are certainly things that we can do to optimize that latch because it should not be painful.
Right. Okay.
Yeah. Go ahead.
Did you have one?
No,
Okay.
go ahead.
I wanted to go like a further down the line then. So if let's say you have had issues with latching and you're dealing with like clogged ducts or mastitis, is that something also that you deal with and help your patients through? How do you deal with that?
So same sort of process. I come to the home, I get a history of how feeding has been going, what the presenting problem is. If there is, blockages or potential infection, I always do a breast assessment first, always asking for permission to touch the breast. And then I will also observe the feeding and see if there's anything that we can optimize to help prevent those blockages. And then we're often doing a little bit more problem solving. Why did we get the blockages? What led to the mastitis? With mastitis, it's a whole spectrum of mastitis. So if it is in fact like an infective case where mom has fever, chills, body aches, then my first recommendation is you need to go seek medical attention. You'll probably require antibiotics at that point in time, but it is still safe to continue breastfeeding. The milk is not infected. The milk is not bad to feed your baby. So we definitely want to keep feeding through the recovery of the mastitis. And sometimes we do need to do a little bit of additional milk removal afterwards because we just want to ensure that the breasts are comfortable and soft, whether it's with plug ducts or a mastitis. We don't want to, or we shouldn't be trying to remove every last drip and drop of milk because that can create oversupply and that can just perpetuate the problem. So we want comfortable breasts, soft breasts. We used to think that heat applied to the breasts was the best way to manage blockages or to treat mastitis, but now we know that ice is the best way to reduce swelling or inflammation in the tissue.
That makes sense.
Yeah, so the practice has changed over the years. And then one thing that I do with Nourish that I feel is value added but so important is that I provide ongoing text, email, or phone support to my moms after the initial consult or after any of our consults, because I know what it's like when you go down the rabbit hole of Dr. Google at 4 a.m. when you're like, okay, what is going on? I would rather that my families reach out to me to get consistent, solid, evidence-based information to help support their challenges instead of going on the internet and feeling overwhelmed and confused.
That's amazing.
So I want to know a little bit more about another really common issue, which would be like low milk supply.
That's a big one.
Women in my circle have some struggles with low milk supply. And so what are some of the best ways to approach that concern?
It is a very common issue with a lot of the moms I work with. The best first way to increase milk production is additional milk removal. So if it's appropriate and if it works for the family, then doing some additional hand expressing or pumping after feeding is the first best way to make more milk, because it's just that, supply and demand. The more we can demand of the breasts, we hope that the supply will respond. Often I describe it as being a milk detective. I have to ask a bunch of questions about, medical history, the pregnancy, early postpartum period. There are lots of factors that could contribute to low milk supply. One of the big ones that I have found over the years is like if a mom has low iron, low hemoglobin, or if she had a postpartum hemorrhage after delivery, because our milk is made from our blood. And a lot of women don't realize that.
Wow.
Yeah, that's where it's made. That's how it's produced. So if we're low iron, low hemoglobin, low ferritin, sometimes it can just take longer for the supply to build. So we want to make sure that we are correcting any of those deficiencies. We want to ensure that we're doing good nutrition support. There isn't any magic food that's going to make copious amounts of breast milk, but foods that are high. So foods that are high in fiber, omega-3s, and iron can be supportive of milk supply. And then again, it always just goes back to assessing the baby feed. Like, is your baby latching optimally? Is your baby effectively and efficiently pulling that milk out? Because if your baby's not doing that, then it's going to downregulate your supply if we're not moving that milk out. But it is a very common issue. If a mom's had a breast surgery, whether it's an augment or a reduction, that can lead to some supply issues. If there's a history of polycystic ovary syndrome, gestational diabetes, high blood pressure, there's lots of different factors that can contribute to low supply.
Fascinating.
That is really interesting. And I feel like a lot of what you just said is stuff I've never heard before.
Yeah.
In terms of like ways to increase your milk supply. Like what you said, there's no magic food. Like I feel like when I was breastfeeding, I was getting a ton of content through like TikTok or Instagram shorts.
These are what
like,
you should have.
Eat these 5 foods to increase your breast milk supply. Da da da. And I think a lot of what you just said, like I've had friends that have eaten all the magic foods under the sun and still not gotten to whatever their goals were with that. And so I think from an emotional standpoint, like, have you noticed that those two things can often get tied together for women, like not being able to like
100%
produce enough milk?
Yeah. I would say that's probably the biggest emotional like stressor for moms is if they are working really hard to build up their supply to meet baby's demand. And in those situations, a lot of moms are doing what we call triple feeding. So triple feeding is they're breastfeeding and then they're bottle feeding and then they're pumping.
Yeah.
Right? Yeah. They're needing to bottle feed after breastfeeding to ensure that their baby is getting adequate calories to support growth. And then they need to pump to maximize milk removal to help build the supply to meet their baby's demand.
Right.
And triple feeding is not meant to be long-term. It's not sustainable. I don't want my moms to have to do it for more than a month, maybe 6 weeks maximum, because then you just feel like your whole life is just spent around feeding and bottle feeding and pumping. And if you're not really seeing an increase in the supply, then I always say to my moms, okay, we gotta come up with a plan B that works for you. Yeah. And often at that point, what we might move to is you breastfeed your baby gets that amazing milk that they get directly from your breasts. And if you need to give a top up of express breast milk or formula after, that's okay. And then often the pumping begins to slow down, or we phase that out altogether, because pumping does take a lot of time, right?
Yeah,
it's time consuming. Yeah. And again, you got to be able to enjoy that postpartum period with your baby and not feel like everything is so task oriented. Yeah. So having those plan Bs when the plan A doesn't always come to fruition is also important. Yeah. And it's okay, right? Sometimes you just need that permission that it's okay. Like you don't have to keep doing this unsustainable way of feeding your baby for the next year. Like there's another way we can do this that works for you and your family.
What a relief for moms, I'm sure, to get that. And to also have that support going forward, being like, okay, so next, here's what we can do. Here's the next phase of our plan. I want to ask, so when they're doing that triple feeding and then they decide to phase out, like you said, the pumping, and you start to change the plans, how are moms assessing babies' feeding? Like, how do they know when baby is fed and what's appropriate, like how much milk to give them from a bottle and stuff like that? Great
question. So it's all about watching your baby, listening to your baby, trusting your baby. If it's a mom who's had, some supply issues and does need to do some topping up after breastfeeding, we usually try to cap breastfeeding at about 20 to 30 minutes. Because sometimes the concern is that if you're feeding your baby for too long, if there's low supply, then they might be using a little bit more energy to try to pull the milk out of the breast than what they're actually getting from feeding. And sometimes we run into issues where like their weight gain will slow if they're like using more energy than what they're getting from the breast. So in those situations, we'll usually say breastfeed for about 20 to 30 minutes. Sometimes we implement a strategy called switch nursing, where you're doing like 5 minutes, 5 minutes, 5 minutes, 5 minutes, just kind of shorter intervals to kind of keep baby awake and help maximize that milk removal. And then at the end of that 20 or 30 minutes, if your baby is still acting hungry And those signs would be like hands to mouth, they're rooting, they're fussing, they're just not appearing kind of like milk drunk the way a lot of babies do when they're done. Then that's when we would say, okay, you're going to offer a top up of either express breast milk if that's available. If that's not available, then formula. And kind of deciding how much milk to offer them, that can be a little trickier because we kind of then have to figure out, well, how much milk are they drinking from direct breastfeeding to determine how much milk do they need in that bottle afterwards to support their growth. So that's where I come in with my scale, because I like to do a pre and post feed weight. So we weigh baby at the start of the feed, weigh baby at the end to get a pretty accurate idea of how much milk they're drinking in order to determine how much we give them after. And I'd say for most of my clients, usually we're starting with maybe like an ounce or 30 mils in a bottle after breastfeeding, and then we increase as needed to ensure that baby's getting enough to eat. And babies should really settle within about 20 minutes of finishing a feeding, because their wake windows are not super long in those early months, right? About an hour or so. So if you've been already feeding your baby for, breastfeeding for 30 minutes, and then maybe the bottle's taking 15 minutes, like your baby should be pretty satiated at the end of that feeding session. And if they're not, that's usually their way of telling you, I still need a little bit more.
Right. Fascinating. That makes so much sense to me. And I feel like that also, kind of what I mentioned earlier, it gives moms like, okay, we have a plan now. We know what we're looking for. And then what I noticed was cool as my motherhood progressed was you really start to know what your baby needs. And you start to know what you're looking for. And so it's really neat that you're able to give those tools to moms too, who need just like a little bit extra support. And I think you touched on also the expectations that mothers have going into it can be a lot of weight on our shoulders. And so, it's amazing that you have this as an opportunity for them to feel like, okay,
supported.
Yeah. There's options for me.
That's the biggest thing is just making sure that they feel supported and knowing that the questions that they have are so normal.
Yes.
Like you're getting to know your baby. This new little person has just arrived on the planet. Like you're getting to know them. They're getting to know you. Like it takes a little bit of time to like get this relationship figured out.
Yeah, totally. So what are what's some advice that you could give to moms once they've kind of started to figure things out? How can they take care of themselves a little bit more? Some more self-care practices that will help them have a good relationship with their feeding journey.
I think it's important that moms ask for help when they feel that they need it, because that sleep deprivation piece sets in very easily, very soon into the postpartum feeding journey. And we always say like, sleep when the baby sleeps. But a lot of moms tell me like that's something they find really challenging to do during the daytime. Like, you want me to nap when my baby's napping, but then I've got laundry to do. I've got to like also feed myself. I want to maybe have a shower. So like, it's okay. Like ask for help, ask a family member, a friend, just somebody to come over and just be with the baby, watch the baby for an hour or so that you can just get some of those things done if you want, or sleep. That sleep piece is so important because those nights are pretty wild for the first long-ish period. So getting a little bit of extra rest during the day is really important. And then it's okay to want to have those moments of self-care. Like if you want to go and get your hair cut or go get your nails done or just even like go for a walk or go to a coffee shop by yourself. Those things it's okay to want to do those things for you, because when you have a new baby, everything kind of feels like it's all about the baby. And a lot of the time we feel like we're number two. So we have to also make sure that we're putting ourselves number one.
That's great advice.
I had some questions around like nutrition and self-care, like for moms, because I know like for me, like those first couple weeks, like I was so hungry, like just couldn't eat everything in sight.
Totally.
So like what kind of things should moms be looking for nutrition wise to best support?
So things that are easy to snack on, because if you're feeding your baby like 8 to 12, 14 times a day, you're kind of sitting in one area for an extended period of time. A lot of the moms I work with will have like a little like feeding station for baby and for them set up right, next to their chair or the bed. So like protein bars or like trail mix, or I make these, like I call them lactation love bites. It's just like a high protein little power ball, very high fiber. So foods that are high in fiber are known to be supportive of supply. So your whole grains, green leafy vegetables, oatmeal is often a favorite food for a lot of breastfeeding moms because it's got iron, it's got high fiber, and it's also pretty filling. So you don't need a lot of oatmeal to feel like you're full. Foods that are high in omega-3s are also good for supporting supply. There are some studies that link increasing the omega-3s in the maternal diet that can increase the fat content of breast milk. So your fatty fishes, if you're not a fish eater, your nuts and seeds, avocados are also a good one. Or a lot of moms too are taking an omega-3 supplement. And then your iron-rich foods are also important because, again, your milk is made from your blood. And our bodies do need about an extra 500 calories per day to keep up with the demands of making milk. So just kind of bear in mind, you still do need some extra nutrition support to, stoke that metabolism while you're making milk, and then stay well hydrated. A lot of moms will almost feel like they just get dehydrated as their babies are feeding. So always have like
water.
Big bottle of water next to you. Sometimes I'll say add in some electrolytes in those early days and weeks. Like labor is intense. We're losing a lot of fluid. We're losing a lot of, vitamins and minerals from our own bodies. So those electrolytes can be helpful, as well in those early weeks.
Yeah. Interesting. So I kind of want to pivot a little bit.
Okay.
And I want to talk a little bit more about Nourish as your business. Like, do you mind giving us a little more insight into the types of support that you offer, a little bit more on maybe like Project Angel and things like that?
Yeah. Okay. So we do primarily provide the in-home breastfeeding support and education for feeding families in Calgary and surrounding communities. We do also have lactation consultants in cities all across Canada, which is very exciting. So in Alberta, we have a lactation consultant that also works in Edmonton. And then in BC, we have LCs in Vancouver and Maple Ridge and Chilliwack.
Wow.
And then our newest addition is in Estevan, Saskatchewan. So she supports Southeast Saskatchewan. And then in Ontario, we have a lactation consultant in Toronto, in the Burlington area, and Essex County. So we are expanding so that we can continue to support families all across Canada. And in addition to the breastfeeding support, so we also do bottle feeding support. So if families are wanting to introduce a bottle or struggling to get their baby to take a bottle, we can support that. We also support pumping, whatever that might look like, breast shield fitting, just optimizing pumping for families. We do offer the breast pump rental program. So we do have the hospital grade Medela Symphony breast pumps that we rent out. That is just available here in Calgary, Alberta. And we do our monthly breastfeeding basics workshop. So that's delivered via Zoom on the last Tuesday of every month. And that class is specifically designed for the expectant mother to prepare for the feeding journey. And that is also offered across Canada, and that is free. So anybody can sign up for that. Yeah. And then we also do a bottle feeding your breastfed baby course. That's also offered. It's free. It's online. That one runs every couple of months, and all the information is located on the website. And then Project Angel Pump is one of my passion projects to provide good quality breast pumps to low-income women in Calgary, because breast pumps are expensive.
They're very expensive.
They are so expensive. And for a mom who is struggling to feed their baby and is perhaps low income, spending a couple $100s, if not more, on a breast pump just is not reasonable. And then at the same time, purchasing like a $25 hand pump might not be the best option either.
Yeah.
So Project Angel Pump will loan out the Medela hospital grade breast pumps at a subsidized cost for women in need. It is a referral based program, so we do require a referral from either a hospital social worker, community social worker, or a physician to facilitate that.
Makes sense. That's amazing. What an impact on so many people's lives. That's really, really cool. What kind of feedback have you received from your programs?
I think it's been pretty good. I would say a lot of the moms that attend like our breastfeeding class, they've also attended some other classes, and they tell me that they've been able to, learn different things from my class, especially about the breastfeeding pillow, because everybody seems to think they need a breastfeeding pillow.
Yeah,
and the other thing I tell my moms is that you don't need a breast pump either in those early days. Like, don't go out and buy an expensive pump, because like your hands also can do a really good job in those early days at removing a colostrum especially. And I think just the kind of extra level of support that I like to provide in terms of like anybody that attends my classes online or the in-home support, like just shoot me a text, email me, call me. You got a question, I'm more than happy to help answer, give you the information and knowledge that you need to successfully go about your feeding journey.
So wonderful. I'm curious, have you seen many partners get involved, like male counterparts especially? Have you seen that sort of interest in like your workshops and things like that?
Yeah, I would say at almost every workshop, there's a handful of dads or support people that also attend. And a lot of the times when I'll get like a referral come in through the website, if it's been a dad that's called me or a dad that sent in the referral, then I'm like, okay, like things are probably really desperate now if dad is reaching out, like because the dads often they feel a little bit helpless, like they want to help but they're not quite sure how to help. So I feel like when a dad reaches out to me, it's like, please help my wife. So I love when the dads are involved, and a lot of the time too the dads will participate in the consultations because I want them to be able to see from all angles. Sometimes they'll do they'll video, they'll take a photo, because as a new postpartum mom, like we're so sleep deprived and I talk a lot. There's a lot of information. So to remember, and I mean, I do document all my notes, but I also feel it's helpful to have the partner available to listen, to help reinforce some of those things that I've been teaching during the visit.
That's so cool. Yeah. What other ways can partners support breastfeeding mothers or mothers just feeding mothers, I suppose?
Well, I think just asking, what can I do to help you? What do you need? Sometimes we're bad at being able to, ask for help or even be able to tell our partners what we need. So just, bringing a snack, making sure the water is replenished, making sure mom has like maybe some extra pillows, a little footstool, kind of going back to the stress. Sometimes I'll suggest putting some heat between shoulder blades. So getting a heating pad or like one of those magic bags and just giving it to mom, putting it around her neck or between shoulder blades. It's often just those like little things, but they can make a big difference.
Huge difference.
Such a big difference.
Yeah. You and I, Maddie, both and I can attest to that. Like just the little things really make a huge difference in your postpartum. And and especially the connection with your family unit. We touched a little bit on that in other episodes, just how you're creating this whole new dynamic in your home. And so, there's a lot of little steps that can kind of not make or break the situation, but can make a situation feel much more comfortable. And, like you're embarking on this journey that can be positive for the entire family. So
for sure.
Yeah. On that note, kind of to wrap things up, I want to know, what are the biggest breastfeeding myths that you would love to dispel?
It's one that I've heard a lot lately, and I think there must have been something on TikTok, is that there's like night milk and morning milk.
Oh, interesting. I have heard this.
Right?
Yes.
So like moms think if they're pumping and if they're, wanting to give a bottle, if they've pumped milk like in the evening or at night, that they can't give that milk in the morning because that night milk has more melatonin in it. And it's, that milk is supposed to be given at night. That's not the case. I always say all milk is good milk. Any milk that is pumped can be given at any time, day or night. So I'm not quite sure where that all started, but I think there was something on TikTok.
I've for sure seen multiple videos about that.
Yeah.
Oh, interesting. Yes. Time to start putting out our own content and dispelling that.
And then the other one is, if you struggled to breastfeed your first baby, or if you had low supply with your first baby, then you're going to struggle with your second. Yeah. That's not the case. It's actually opposite, because with each pregnancy, your breasts lay down more mammary breast milk production tissue. So if you had issues with supply with your first, your breasts are going to be making more breast milk production tissue with the second and with the third.
Wow.
And we do tend to have more milk with each consecutive baby. So yeah, every journey is different. Every experience is different, but don't let anybody tell you that if you had low supply with your first, you're going to have it with your next baby.
Okay, personal question then. I had a lot of supply with my first baby. And so should I be concerned? Is there anything that I can do to, I'm concerned with getting like clogged ducts and things like that. Like if oversupply becomes an issue, how can I be careful with that going into my second?
So same thing. You will most likely have more milk with baby number 2. Even though you had lots of milk with baby number 1, you will potentially produce more. So sometimes we do need to do a bit more regular icing to help slow down milk refill or manage some of those blockages. Sometimes at the beginning of feeding, we have to do a bit of pre-expression. So taking off a little bit of that fore milk or that milk that's going to flow really quickly. And that's not going to drive the supply up even further if we're pre-expressing. And it's just taking off a little bit. And then again, just feeding to comfort. So making sure that you're not doing too much additional pumping or milk removal after breastfeeding. Because that will just ramp up the production. We just want to make sure breasts are comfortable at the end of feeding. And sometimes we'll also do what we call block feeding if you have lots of milk. So that's just one breast per feed. So usually for like a 2 or 3 hour window, you just feed baby on the one side. We leave the other breast alone unless it is feeling like it's going to explode. Then again, it's just expressing to comfort, just taking the edge off. And that helps to downregulate the supply.
Good to know. Thank you so much. That's invaluable information. You have no idea. Amazing. Okay. And maybe last question then. What is one piece of advice you'd give to moms that are in the thick of the early days? I feel like we've covered a lot of content, but what's maybe one last piece of advice?
Just that there is help out there. Don't feel like you're in it alone. And for most breastfeeding issues, there is a solution. Like it might not be super black and white, but we can usually come up with a plan that helps you achieve your goals. And just, I wish every mom knew that they're not in this alone.
Yes.
Because sometimes that postpartum period can feel very, very isolating. And a lot of women still aren't super comfortable talking about all the breastfeeding issues that they've had or are experiencing. But just know that they're not alone. That's why I have a job, because there's so many moms that do struggle to feed their babies, and Nourish is here for you.
Yes. Amazing. Well, and we want to thank you again for your time, because that is ultimately our mission, is to make sure that other moms feel like they're part of something, and that we can all support each other in whatever unique journeys that we're on. So I really appreciated the values behind your mission as well.
Thank you.
And I think it's amazing that you've been able to share your expertise. It's just so cool.
Well, thank you for having me.
On that note, where can people find you if they want to connect with Nourish?
So they can find us online at www.nourishconsulting.net. They can find us on Instagram at Lactation_Leanne R. And they can also email us at hello@nourishconsulting.net.
Awesome.
Perfect.
On that note, all of those links will be in the show notes below. So if you want to connect with Leanne further, you can find her there. And thank you so much for joining us today.
Thanks, guys. Okay, bye. Much love. So amazing.
That was